All right, we're going to begin the public hearing on community service appropriations, which is required by a federal law. And so we do have a couple speakers, but first I want to kind of run through the procedures. Well, first I should introduce ourselves. So I'd have Representative Ronnie Marquardt. Would you introduce yourself?
Thank you, Representative Ronnie Marquardt.
I'm Representative Gary Moore, Chairman of the House Appropriations Committee.
Representative Van Meyer.
Representative Norland Mumpson.
All right, that's all of the representatives that are present here today. We do have a couple of speakers that signed up to speak. So you'll be given 2 minutes in which to speak. We'll have a timer down here. I hold up the yellow card, which is 15 seconds left. The red card will be to stop. And so that's by House rules. So we have to abide by that. And so I will ask you to stop at that point. So if there's no further discussion from the legislators, I'll ask one of you, whichever one wishes to go first, or is there one? All right. So go ahead and please state your name, who you represent, if you represent anybody, and then whatever you want to tell us about.
You bet. My name is Leslie Carpenter. I'm with Iowa Mental Health Advocacy, and I'm here to speak in favor of this bill. And I would like to cede the rest of my time to the other speaker so that she has enough time to address what's on her paper. Thank you.
I don't think that's going to be allowed. Good try.
Thank you all. My name is Deborah Thompson. I'm a citizen from Urbandale, Iowa. My comments implore better investment in Iowa's public health system. So I'm for the bill, but interested in the federal COVID stimulus funding that's coming in. Public health is a practice. It dedicates itself to understanding why people become sick or injured, and then promoting strategies to prevent a sizable number of the whole population from becoming sick or injured in the same way. So if you think of a river where people are drowning, a first instinct would be to put resources into assuring that the people who are drowning are saved. A better idea, and one that's typically less expensive and far more productive, is to understand why people are drowning in the first place. So spending lots of money to send an ambulance and to take people to a hospital over and over and over and over and over again, or spending a few dollars to put up signs warning people away from where they could fall in the river in the first place. That's kind of what public health is all about, is prevention. And when you compare Iowa's investment in direct healthcare services and treatment compared to our investment in preventing the need for all of the healthcare services and treatment, it's pretty clear that we should rethink our priorities. The massive amounts of federal money coming into our state due to COVID is a great opportunity to reimagine how we're proactively protecting the health of Iowa's workforce and the health of our kiddos, who are the future workforce in Iowa. So here are 2 ideas for the sake of time, and then I intend to email other ideas in a document that I'll be submitting to you. I would encourage that $250,000 or more be invested to conduct, or directed to conduct, a comprehensive independent review and evaluation, complete with policy and funding recommendations, of course, of the existing public health infrastructure in the state. So that would include the governmental public health system, like county agencies, the state health department, the state hygienic lab, as well as the workforce pipeline, to understand where we are currently so we can be informed on where we need to go. I would also like to see at least $19 million or more for information technology updates, improvements, or replacements to provide for accurate and timely collection and reporting of data and information related to population health priorities at the local level. Thank you.
Thank you. And you said you were going to be emailing these
Yeah,
these
I
things.
can email more information.
Okay, that'd be perfect. So thank you for your time, and thank you for your time as well. And thank you for your input. Is there any discussion from the legislators before we close? Representative Ronnie Marquardt or Representative Moore? Representative Moore?
Thank you.
All right. Thank you for your input, and I'll call this meeting closed.